So I think younger people should be aware of their risk for colorectal cancer for two reasons. One is because some of the risk factors that put us at risk for developing colorectal cancer are associated with unhealthy living and eating habits. So in your 20s, 30s, 40s, great opportunity to make healthy choices that can affect your health for your entire life. But also because nobody is really immune to colorectal cancer. Even if you have a very healthy lifestyle, it is still important to know what some of the signs and symptoms are of colorectal cancer, because we are seeing it occurring in younger patients more frequently than we have in the past. For example, in 2019, there was a study that showed that 1 out of every 5 patients with colorectal cancer were younger than 55, which was really stunning because in the 1990s, about half as often, but really it's been going on for well over 10 years now. So nobody really knows the reason why we're seeing a downward shift in the age of people developing colorectal cancer. There are some theories, some involve the microbiome, some involve the type of bacteria that's growing in your teeth and in your mouth, and dentists have been talking about this for some time. I sort of think there's a lot to do with processed and ultra-processed foods. That was never the case several decades ago, so you see trends towards really kind of bad foods that are really cheap, inexpensive, taste good, that are widely available. That might be causing at least some of this downward trend. But the truth is, we don't know with confidence why this is happening. So the most up-to-date recommendation in terms of when to start screening for colorectal cancer is the age 45. It used to be 50. 45 is the new 50. But there are some reasons that we would recommend screening even earlier than that. So for example, if you do have a family member, especially a first-degree family member with a history of colorectal cancer, we would recommend starting that screening process 10 years earlier than their age at the time of diagnosis. So if your father, for example, had colorectal cancer at the age of 45, then we would recommend that you start screening at the age of 35. There are other recommendations too. So for example, somebody with inflammatory bowel disease, we would want to start a lot earlier. So some of the symptoms of colorectal cancer would be blood in your poop. That's not a normal thing to happen. There are plenty of reasons to have that for things that aren't cancer. But if it's been happening for weeks and not getting better, it's time to talk to your doctor. If you have a change in the caliber of your stool or poop, is it getting very narrow or ribbon-like? Do you have the sensation of incomplete emptying? So you go to the bathroom and you have to go again and again. These can be signs of colorectal cancer. If it happens once and it never happens again, you're going to be okay. But if this is something that happens and it's still happening in weeks, it's time to talk to your doctor. So yeah, as a surgeon, I would love to be put out of business, which would mean nobody is coming in with cancer. This is a dream-like outcome for me. I would love it to be put out of business. So what can we do to really prevent colorectal cancer? I think of a couple things. One is really trying hard to live a healthy life, because things like high BMI, things like smoking, things like moderate to high alcohol consumption, these will all increase your risk of colorectal cancer. So if we live healthier, maybe we'll reduce our risk of getting cancer. But it's not just cancer, not just colorectal cancer. This will reduce your risk of so many negative health complications, other types of cancer, heart disease, stroke, all the things we really want to prevent. So just live as healthy as you can.